Thank you, Sandra. Thank you, everyone, for joining us today for this breakout session. Amy and I are both super excited to be here with you to share some information. Today's program is titled Community Supports for People Impacted by Dementia. Amy and I would both appreciate interaction from everybody here today. So if you would like to comment, share your thoughts, or even if you have questions, please feel free to use the Zoom chat function. And if we don't answer your questions during our presentation, like Sandra said, we'll make sure to get them answered at the end of today's presentation. Today, we will cover a range of topics, looking at the differences between Alzheimer's and dementia, to the warning signs, and wrap up with some programs and services provided by Memory Care Home Solutions, the Alzheimer's Association, as well as other resources for families, with the hopes that by the end of today's session, you will be able to identify the signs and symptoms of dementia, the prevalence of this condition in Missouri, discuss the impact of dementia on caregivers and family members, describe the referral process and free services available to families through Memory Care Home Solutions and the Alzheimer's Association, as well as identify additional services and supports to promote quality of life for this vulnerable population. So I would like to begin today's presentation by posing you a question. Alzheimer's is a normal part of the aging process, true or false? Feel free to think it over, use the chat function. And why I ask you this today is because it is often one of the most common myths surrounding Alzheimer's disease today. The belief that Alzheimer's is a normal part of the aging process when it is in fact not true. We will cover this topic throughout this presentation, as well as begin today's conversation looking at the differences between Alzheimer's and dementia. So out in the community, you may have heard the terms Alzheimer's and dementia be used interchangeably. Now, while they are important, while these topics are related, there are important differences between the two. Dementia is really an umbrella term that describes a group of symptoms associated with a decline in memory, reasoning, or other skills. Some of these symptoms include short-term memory loss, changes in the person's ability to read, changes in the person's ability to function in their day-to-day life. While there are many different types of dementia, many conditions cause it. Alzheimer's disease is actually one of the most common causes of dementia, and it accounts for approximately 60 to 80% of all dementia cases. It is a progressive brain disease with a hallmark of these brain structures called plaques and tangles that are thought to damage and kill nerve cells. Alzheimer's is only one of the most common causes of dementia. We also have Lewy body dementia, frontotemporal dementia, vascular dementia, which all impact families here in Missouri. So it's important to be able to understand what are the warning signs that we should be looking out for in ourselves, the people we serve, or someone that we know, and what can we do about it. The Alzheimer's Association has put together a list of 10 warning signs to help people understand the differences between normal aging and possible signs of dementia. This list is only intended to be a tool for families and does not substitute an official diagnosis. We're not going to be able to go in depth into all of these warning signs today, but if you would like more information, you can always visit the website alz.org/10 signs. So the first warning signs is memory loss that disrupts daily life. And oftentimes this is the most obvious one. We observe that a person is forgetting newly learned information. Number 2, challenges in planning or problem solving. And we often see this when the person that has often paid the bills all the time has issues now paying their bills or managing their finances. Number 3, difficulty completing familiar tasks. Our seniors did not grow up with complex cell phones. And so you may begin seeing that they have issues with their phones, or maybe the remote control, or even the microwave. Confusion with time or places, number 4. For example, forgetting a doctor's appointment that they would have typically not forgotten. Number 5, trouble understanding visual images and spatial relationships. Number 6, new problems with words in speaking or writing. Number 7, misplacing and losing the ability to retrace steps, for example, car keys. And as care partners, we may find it in the most random places like the fridge, underneath the sofa covers. Number 8, decrease or poor judgment. Number 9, withdrawal from work or social activities. And then number 10, changes in mood or personality. Please note that it's not necessary for a person to experience all of these warning signs for us to be concerned. A person may experience one or more in varying degrees. And when we do observe these warning signs in someone that we know or in ourselves, it's important to encourage them to begin that conversation with their doctor. And the doctor may then recommend seeing a specialist like a neurologist. An early diagnosis of Alzheimer's or any form of dementia is extremely important because it can open up a range of benefits for that individual experiencing memory loss. Those benefits include access to treatment options, opportunity to participate in clinical trials, opportunity to prioritize their health, more time to plan for the future. We know that Alzheimer's disease and other dementias are impacting families here in Missouri. As of 2020, over 120,000 individuals over the age of 65 are living with the disease. And they are supported by over 194,000 caregivers. And we know that caregiving is hard and difficulty. And many caregivers do it out of the goodness of their hearts, and some are just put in that position. Caregivers right now are providing over 292 million hours of unpaid care, which adds to a value of almost $4.8 billion. Alzheimer's disease is impacting the number of hospitalization and emergency room visits that we're seeing. The cost of Medicaid is increasing because it's supporting a large number of people who have this disease. The Alzheimer's Association and Memory Care Home Solutions have seen the impact that the COVID-19 pandemic has had on families. And I found this statistic surprising that in 2020, there were over 1,000 more deaths than expected from dementia, which is 20% higher than average. And we know that Alzheimer's disease is the 6th leading cause of death. And so now I will hand it over to Amy, who is going to talk more about the impact that this has on caregivers.
Yeah, so a lot of us, we're kind of thrown into the caregiving role. None of us are really prepared for caregiving. There's not a manual or training. And as a result, a lot of it, the chronic stress and health consequences really hit caregivers by surprise. And a lot of conversations I have with clients are, oh, I didn't realize that my sleeplessness was a stress response, or I didn't realize this health issue was a stress response. And unfortunately, we see that often. The chronic stress and not able to manage it in healthy ways really impacts overall physical and mental health. Changes in work schedule availability for working caregivers can be very hard to balance and juggle all of those responsibilities, and even result in the opportunity of kind of not taking promotions or not taking work opportunities that you may want that would require more travel or more commitments. And then finally, the shifting roles and responsibilities of family members. I think this is one of the most challenging aspects of caregiving because the dynamics and kind of function that you've always been used to starts to change. And so the roles, the responsibilities, we're starting to see those shift. And that's a very challenging adjustment. Like Ben said, the impact is not always negative. There are positive impacts to caregiving. And many people report that having that meaning and purpose, being able to give back to someone, support them in a really challenging time is very important to caregivers. And I also often hear that strengthening relationships between the person that they're caring for and the whole team in general is often really beneficial. I have one client that he's been kind of estranged from his siblings over the course of his life. Now, in caring for their mom, they've been able to improve their relationship with mom, but then also each other. So there's negatives and positives, lots of different impacts to consider. Whenever we're looking into kind of rural health specifically, so if you want to, yeah, thanks, Ben. So like Sandy mentioned, I grew up in a rural area in central Illinois. And these issues I saw a lot with my family of when my grandma, we were trying to get a diagnosis. We were trying to just start the process. There are so many barriers to making this happen. And so we just wanted to highlight some of those and talk through ways that it makes it a little more challenging in rural areas. Unfortunately, just nationwide, we have a shortage of specialists in geriatrics and neurologists, even in urban areas. What that means for rural areas is that we're often driving to see providers, or we're waiting until kind of there might be a clinic day, like once a month or every couple of weeks. It can be very challenging to see a specialist. And as a result, many people go undiagnosed or misdiagnosed. They try to manage it kind of with their existing healthcare team and aren't getting kind of the specialized care that's needed. Additionally, we see fewer supports and services, a lot of times just due to kind of the service area is larger, there's less staff. It can result in kind of greater pockets of people not being able to have support and resources for managing this disease. What we often see in, especially the area I grew up, privacy is very important. There's kind of this attitude of we're self-sufficient, we're very independent, and that can work against us in trying to seek a diagnosis and also building a care team. Um, we know that just in rural areas, we're driving everywhere. And so driving is really the ticket to independence, even more so in rural areas than urban areas, because there isn't public transportation. You need a car, a vehicle to be able to go places. Especially for farming families, there's just kind of an extra level of concern and risk. Um, I remember during planting and harvesting seasons, there was kind of extra care we had to take to make sure that my grandma was safe and that she wouldn't be potentially hurt by big equipment or tools or kind of being lost in the chaos. It can be very challenging trying to manage someone living with dementia if they're still farming and operating big machinery. It can be a huge risk. And then finally, we often see just the prevalence and attitude of firearms can make it difficult to even have the discussion of how are we practicing good gun safety. And so what we mean by this is that, like Ben mentioned earlier, with orientation changes, we might not recognize who's coming into the home as our family or our friends, and it mistake them for an intruder. If there's a gun available, we might react to protect our home. Unfortunately, I've seen this over and over and over again, and some more deadly than others in those situations. So It can be a huge barrier to even talking about that conversation, because there is that importance of having a gun in the home, being able to protect your home, but also recognizing the risk with dementia care. And so at Memory Care Home Solutions, we cover kind of all of these things and more with our clients. Just a little bit about us. We are a not for profit organization founded in 2002. Our staff are occupational therapists and social workers. And we look at how we can support families dealing with any type of cognitive changes. Um, and specifically looking at how can we extend and improve quality time at home, because we know people want to stay in their homes. That's where we want to be. So we look at how do we really try to make that happen and make that a reality for folks. So, like I said, with our OT and social work staff, our goals really look at how are we customizing this approach to meet the client, the family's needs. So it's not a one size fits all. It's very focused on each individual's priorities and how we can help answer their questions, address their priorities, and build a plan that they're leading. We're looking at how we can create a dementia-friendly, safe environment. So it's set up for safety, but also functioning. We look at how we can improve the activities of daily living and instrumental activities of daily living, while also reducing challenging behavioral and psychological symptoms of dementia, because those are really the biggest challenges when we start to see things like sundowning or hallucinations, not sleeping at night. That's when it gets really hard to continue care at home. So we try to monitor those and be able to intervene and have good solutions in those moments. And then finally, we look at the care partner, the caregiver. How are we reducing their stress, improving their understanding and confidence to manage this disease, and be a support for them and build their team. And ultimately, we're hoping we can stay at home longer and reduce long-term care placement. So our program is a program called COPE, so Care of Persons with Dementia and Their Environments. Healthcare, we always love our acronyms. But so COPE was developed initially in the research setting. We received a grant in the past several years to modify it for the real world. And so this is a study that just showed kind of all of the different outcomes specifically for people living with dementia and then also their care partners. So for people living with dementia, we're looking at improved function for activities of daily living and instrumental activities of daily living. And so you might be thinking, well, how can someone improve their function in a progressive dementia or a progressive disease like dementia? What this program really looks at is that we're setting up the environment, we're setting up the task to simplify and to help someone remain independent. So we're not doing for them. And whereas before it might have been too challenging and too complex, we're reducing the steps and simplifying. So this program has shown that that function is improved and can maintain that independence. And then additionally, we're looking at increased engagement in activity. So we know a routine of structured activity and engagement is just so essential, one of the best medicines for dementia. And so having someone being able to maintain that in their routine is critical. And then for care partners, like I mentioned, this program really looks at how are we increasing confidence to manage care, and then overall health and well-being is just as much of a priority as the person living with dementia. And so what this looks like for the dyad is we're not just treating the person with dementia, we're not just treating the caregiver, we're treating them together. We're identifying preserved strengths, roles, and routines for both of them. So making sure that we're doing what's important and what is meaningful and purposeful. And then we're looking at the home and an environment to set it up for safety and functioning and teaching a problem solving approach. So it's kind of like the adage, like teach a man to fish, he'll be able to eat for a lifetime. It's kind of the similar thing of we know we won't be with someone at 3 a.m. or on a Sunday afternoon. And we want to help create this framework of how are we thinking about challenging symptoms, solving kind of a dilemma, and be able to apply what has worked in the past or what has been successful to where we are now. And so that problem solving and brainstorming approach is so important for that reason, but then also that we're building confidence of the caregiver, that they have the answer within them. They know the person they're caring for the best, and we can kind of guide them to what are good strategies and what approaches they can try. So what our program looks like, like I said, we have social workers and occupational therapists on our team. Every family begins with an initial consultation with one of our social workers. And this is very customized to their concerns, their priorities, questions, specific to them. I see clients who recently received a diagnosis, are still working, driving, managing finances very early in their disease process. And then likewise, I see clients who are more at end of life and on hospice. There's kind of all 8 stages in between. It's very customized to what they want to know, what is important to them, and how we can help support them. After that initial visit, we either continue with more visits with either an occupational therapist or a social worker. So the occupational therapy really focuses on hands-on training for the home and environmental modifications, and then also the kind of routine and functioning changes that they might be experiencing. I would say most often what they work on is kind of identifying meaningful activity that we can do throughout the day, and then also helping with activities of daily living solutions. So bathing is one of the kind of biggest challenges that they often see. So trying to work with families of coming up with good approaches and strategies that will help to make sure that we're still doing proper hygiene. And then the social work visits are caregiver counseling based. So we're looking at how are we building positive stress management strategies and focusing on well-being in general. So we might talk about kind of the grief and loss of these diseases and kind of the emotional aspect of just seeing someone that you love and that you care for lose function and kind of continue to decline. And then also talk about what does well-being and respite and self-care look like to them. So if families choose to meet with us for additional visits, they can kind of self-direct how much care and how much support that they want. For families that might want a lighter touch program, we still follow up with them and we'll meet with them at 3, 6, and 12 months after the initial evaluation, just to check in, see if the priorities we talked about are still accurate and relevant, and revisit if they need any other support. So the 1, 3, and 4 on here are all free, thanks to grants and donations. The number 2, the additional OT and social work visits, are covered under healthcare insurance. So we really try to work within kind of the existing healthcare insurance model and be able to offer as many services to clients as they want them. So just a taste of kind of what this looks like in practice. So this is kind of the theme of what we always start with clients, is that we can't change the person with dementia, but we can change our approach as caregivers, the home environment, or the task and activity. And so I'll go through kind of each of these and just give very quick examples of what this would actually look like. So the first one, our approach, I think this one is often the most important. So if you want to go to the next slide, Ben, this just kind of encompasses communication. I often tell families it's almost like learning this new language. And we're moving from this fact-based, rational communication to emotion land. And it's not what we say, it's how we're making someone feel and that they're feeling like we're on their team and not trying to fight against them. And switching from that logical, rational to emotion is really, really hard. It takes a lot of practice. I often work with clients of kind of having practice conversations, especially around touchy subjects, and having pre-planned things that clients will say just to help them feel more prepared. Beyond that, we're trying to accommodate just for dementia as a processing impairment. We know that over time, the brain, what language and words mean can change, and so we're having so much more processing of what does this mean. I'm having to filter out the car siren in the background, the TV blaring, the radio going, and so we found the more we can keep it short, specific, simple, and slow, the more we're accommodating the brain living with dementia to be able to process language and be able to communicate as well as possible. So moving into the environment, we look at how we can simplify routine. The picture on the right, you'll see there are pre-planned outfits. So we still have choice. Someone can choose kind of, oh, I want this one or this one, but we aren't facing someone in front of a whole closet with probably a lot of options that might not be season appropriate. They're able to choose something that's appropriate for right now and in the season right now without being overwhelming too. You'll see on both pictures, we have little signs that have the picture of what's in the cabinet or dresser, and then the word as well. So again, we're accommodating for those language changes that even if we aren't processing what this word means, we're able to see the visual and kind of interpret further. We also love whiteboards and day clocks. So there was one hiding behind the clothes, but being able to orient to very simple schedules and routines can be helpful. This is a great example of a one-step meal. So the picture on the left, we're doing a lot of prep to create a meal or find something to eat. The picture on the right, we grab a bowl, can start eating right away, and we're setting someone up for success. We use a lot of adaptive equipment, the simplified remote, the automatic medication dispenser often used. The picture of the bathroom is a really great hybrid of we're using equipment like the bath bench, the handheld shower head, grab bars, but then also adding contrast with electrical tape and colored mats. So we're compensating for the vision changes and depth perception changes of navigating the environment. This is a great example of task setup. So we're setting someone up for success. If I say, oh, go brush your teeth, and we don't have all the items set up for someone, they're having to navigate between the lotion, the hemorrhoid cream, the toothpaste, the Glade plug-in. There's a lot going on and a lot that can go wrong, unfortunately. And so if we're kind of simplifying the steps it takes for someone to successfully complete an activity, we're going to have more success. And then we were talking earlier about meaningful activity. Every single person needs to feel accomplishment and meaning and purpose. That doesn't change when we have dementia. So we look at what were past hobbies, past interests, how can we adapt them to now? And make sure that we're still prioritizing different ways of engaging our brain. Like Ben mentioned, dementia is really a huge public health crisis. It's a huge expense for our healthcare system. And so we have been tracking data on how our program reduces health events that can be very costly. So we found at 3 months after initial consultation, falls, ER visits, 911 calls, and hospital admits have all reduced. So it's really amazing that the confidence and understanding and ability to manage care at home increases with just 3 months of support. really incredible outcomes. And then, so just one other thing before I hand it back over to Ben. So for our services, so as was mentioned earlier, we serve Illinois and Missouri completely through telehealth and in person in the St. Louis metro area. We also offer consultation nationwide. So we've always worked with clients nationwide and offer any support that we can. To connect with us, you're welcome to visit our website. We have a referral link on the next slide that just goes over if. Sorry, I skipped ahead. I'll go over that in a second, but just who is eligible for our program? They're very simple. We only have 2 requirements: that there's either suspected or confirmed cognitive impairment, so we don't need an official diagnosis. And then there's an informal care partner who's willing to work with us. Most often, I would say that they're family members, but we've had friends, neighbors, priests, everyone in between. So as long as they're willing to learn and be a support, that's good enough for us. The OT plan of care does require a physician order. So that's something that we collaborate with the existing healthcare team on. So here's what I was mentioning about just referring clients or checking out our program. If you go to our website, we have a contact new clients and referrals where we'll contact you and you can put in information that you'd like us to know. You're always welcome to call, fax us. We're happy to talk about kind of whatever the situation is and be a support of however we can.
Thank you, Amy. So in this next part, I'm going to talk a little bit about the Alzheimer's Association, which is a national nonprofit organization with representation locally through different chapters. And I actually work for the Greater Missouri chapter, which serves 86 counties in Missouri and 10 in Illinois. We essentially serve the majority of Missouri except the northwestern corner, which is served by our Heart of America chapter. And we work closely with that chapter to provide services to families throughout Missouri. Regardless, our mission at the Alzheimer's Association is really to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Our vision is a world without Alzheimer's and all other dementia. In this next part, I really wanted to focus on the care and support aspect. What services are available to families through the Alzheimer's Association? And first, the 24/7 helpline. We have master level clinicians who are available around the clock to support caregivers who are caring for someone with dementia, the person impacted by the disease, someone who is interested in learning more. A caregiver can call at 4:00 in the morning because mom is awake and they don't know how to help her get back to bed, and we'll help them through that. Or anybody can call to find out when the next education program is, or where is there a support group that's nearby. We have our website, alz.org, which is full of information for care partners, people living with the disease, professionals. And our chapter website is alz.org/Greater Missouri. As a chapter, we also provide care consultations, which are one-on-one appointments with our master level clinicians to really have a conversation with them about what is going on, what are their concerns, what are their needs. We provide dementia education, we connect them with resources, provide support. And at the end of this conversation, they come out with an action plan to address those needs that they brought to the conversation. It is a free service that we provide over the phone at this time. The Alzheimer's Association also provides free education programs, which can be viewed online on demand, or We also provide them throughout the community, online and in person. Some of these programs include 10 warning signs, understanding Alzheimer's and dementia, and we even explore different topics that are helpful to caregivers, understanding communication strategies, managing challenging behaviors. We also provide support groups, which are online as well as in person right now, which are great opportunities for care partners to connect with other individuals who are going through a similar experience. Um, Lastly, we have early stage programs, which are social engagement programs for the person who has mild memory loss, and support groups for the care partners and the individual in this early stage. As Sandra mentioned, I wanted to talk specifically about our Caregiver Relief Program. We have partnered with Missouri Rural Health Association to deliver this program to help caregivers who are caring for a person with dementia at home. And this is funded through the Department of Health and Senior Services. Through this program, we're able to provide a small grant of up to $700 per year so that the caregiver can hire someone to come into the home, whether that's through a private agency or maybe someone that they know and trust, for them to use adult daycare, to purchase home safety equipment or nutritional supplements, depends. This is a reimbursement program, so caregivers are able to choose the services they wish to use or products that they wish to purchase. They save those receipts once they're enrolled in the program, and we reimburse them for those costs. In order to qualify for this program, the person with Alzheimer's disease or another dementia must live in Missouri, and they must live with a primary caregiver. The grant is capped at $700 per year, and it's subject upon availability. We are distributing this grant on first come, first serve basis. Once the family is enrolled, they'll have 45 days to begin using those funds or submitting for reimbursement. And they have until May 1st of 2022 to use up all of their funds. And this is with the help of a care consultant who will help them plan out how they will use those funds. If they need to find an in-home care agency or an adult day program near them, they will receive the support from the care consultant. So we don't have a paper application. All that we ask is that families reach out to us to schedule that care consultation. They'll receive that free service with our master level clinicians, and we'll help them get enrolled in the program. So again, I just wanted to highlight that the best way to get connected with services with the Alzheimer's Association is to call our 24/7 helpline, which is 1-800-272-3900. If you are a professional and you would like to submit a referral so that we reach out to the families that you serve, we do have a referral form called the Direct Connect Rapid Referral Form. If you go to this link, alz.org/Greater Missouri/referral, you will have access to a faxable form that you can download, fill out, and fax to us, or access to a HIPAA compliant online form that you can complete and submit. And once we receive this, we will reach out to families within 2 business days. Lastly, I did want to invite everybody to our walk to End Alzheimer's. It is that time of year, and we are so excited to be able to give individuals the opportunity to participate in person as well as on their own, whether that's walking in their neighborhoods in support of a world without Alzheimer's. The Walk to End Alzheimer's is the largest event to raise awareness and funds for Alzheimer's care and support and research. We do host these walks throughout Missouri. So if you are interested, please visit alz.org/walk. Lastly, I did want to talk about this new program available to families through the Department of Health and Senior Services, the Structured Family Caregiver Waiver for families who are Medicaid eligible. So, this program was developed to provide comprehensive and cost effective home and community based services for caregivers and individuals with Alzheimer's or another dementia who are living at home. In order to qualify for this program, caregivers must be at least 21 years or older. The caregiver must live at home with the person that they are caring for. The adult with Alzheimer's or another dementia must have a diagnosis by a licensed physician here in Missouri. The adult with Alzheimer's must meet nursing facility level of care, and they must meet the financial and asset requirements under Medicaid. If families that you serve are interested, they can go to the website health.mo.gov/seniors or call 866-835-3505. And then lastly, we do have a slide on additional resources available to families. And Amy, if you wanted to touch on any of this.
Yeah, so the AOTA, so occupational therapy, has a specific microsite on Alzheimer's. We often refer to the National Alzheimer's and Dementia Resource Center. They are funding a lot of really innovative dementia-specific projects around the country. So really a great resource, especially to people who are providing services. Teepa Snow is kind of the dementia guru. So we often refer to her YouTube videos. She has a really wonderful website. Lots of ways to connect with her. They've really increased their virtual programming during COVID. So they have a lot of offerings that are both paid and free for professionals and people living with dementia and lay caregivers. And then finally, the Rosalind Carter Institute for Caregiving has a lot of helpful resources and guides that we often refer to as well.
And that is the end of our presentation. So thank you everybody for joining us today. And if you have any questions, please feel free to